a part of, I think, what makes me a little bit interesting, and I'm sure we'll get into this, is that my husband is British,
Hmm.
and we also reside in Scotland. So when I became pregnant with our first child, all of my prenatal care was in the UK. And therefore, I got to compare, because I gave birth to my baby boy in the United States, I could compare the kind of care that I received.
Okay.
Now, through the NHS, which is the care in the UK, there is significantly less stigma about how much a woman weighs when she has a baby. We actually stopped stepping on a scale in the UK in our second trimester. What I
Okay.
weighed was just no longer a part of the conversation. They encouraged healthy eating habits, and that was pretty much it. They measured the size of my baby. They took care of me. When I get back to the United States, however, things begin to change
Hmm.
drastically.
I'll say.
I have to go into the doctors very frequently at the end of the pregnancy because you have to make sure baby's growing well, and all these things have to be double checked all the time.
Right.
And not only do you have to stand on a scale every time, but they also will kind of make comments about
Hmm.
sort of how you could begin to prepare for birth based on what it is that you weigh. And even
Okay.
while in labor, this was also a factor. And I'll give you a couple of examples. I
Please.
was told at 37 weeks that due to my size, I was highly likely that I was going to have a C-section because they thought that I automatically had gestational diabetes. Now, don't get me
Hmm.
wrong, there's no shame in gestational diabetes. It happens to the healthiest of women, and there's no question that anybody should feel embarrassed about that. But to
Right.
assume that I have it based on my size is problematic. I did
Hmm.
not have gestational diabetes. My pregnancy was completely normal. And there was this heavy assumption that that was going to be the case. And therefore, they were suggesting that I was probably going to have a C section.
Okay.
While in labor, similar situation. In the UK, they use nitrous oxide, which we call gas and air, as sort of a pain management tactic. And they've been doing it there for over 50 years. It's a
Hmm.
really straightforward practice. Here in the United States, it's relatively new. And the
Okay.
hospital I gave birth at actually had just re-implemented it after COVID because you have to breathe in the mask. And, after, with the COVID, all the women needed to wear masks. So they were just bringing it back when I gave birth. Now, in the UK, this gas and air is acceptable for all women giving birth. It is the standard.
Okay.
However, here in the United States, while I was giving birth, I had a team of anesthesiologists come in and suggest to me that I absolutely had to get the epidural because I was so high risk for the C-section. But this was after I had already been promised that I could use the gas and air.
So they said
And
you had to get the epidural.
that's what they said. Now,
Okay.
Josh, my husband, pushed back really heavily on this because he knew what I wanted to do, and he was always going to just be an advocate for me and what I wished. But what they told me was that I weighed too much to use the gas and air.
Okay.
However, in the UK, where they have been doing this for decades and decades,
Hmm.
that is not the case. And I felt really attacked in this situation because I knew it was safe for me to use this. I knew it was safe for me. I knew it was safe for my baby. And the doctors are telling me that that is not the case. Now, hysterically enough, I was very upset at this
Right.
suggestion. I'm obviously in labor. They're making me feel guilty about, how much weight I've gained during my pregnancy, which hysterically was mostly water weight anyway.
All right.
And and basically my nurse took a huge amount of pity on it because she didn't understand what the doctors were saying. She didn't agree. And she actually went to go get another nurse who happened to do her training in Ireland. So she was Irish. She did her training with the NHS and then moved to the United States to practice at the hospital that I was at. And she came in and she said, listen to me. I worked in Ireland and in England for 40 years before I came to the United States. I have worked with gas and air with every patient who's ever had a baby. Your weight has no bearing on using this, this sort of pain relief.
Okay.
And so this was, and I already knew this, but to have her come in and just be like, this is fine, like you can do this and it's okay, was like total relief because I'm being railroaded by doctors who are telling me
Hmm.
something different. Now, of course, hysterically, at the end, we pushed so hard, they let me use the gas and air, and guess what? It was really effective for me. It
Right.
was a really useful tool for me to use, but that entire time, like, I don't want them to think for 1 second that it left my mind that,
Hmm.
like, every time they came in to see if I still wanted the epidural or not, that, like, I weighed too much to be using this, and, like, I was some sort of ignorant and naive, first time mother who sort of overruled their decision, so that I could use the kind of pain relief that I was looking for.
So, do you feel like it was just fate that there happened to be a nurse like not that far away that, you know, I believe got her license in a space or in a place rather, uh that allowed the gas and air, and that was almost like the first like line of treatment. What are the odds of that happening, and how do you think that played a role in the doctors letting you eventually use that?
I don't think that she played a role in the doctors allowing it. I think that they were not gonna. I mean, Josh could be. He's British and therefore could be very blunt, I think is the right word to describe. He can put quite a fine point on things in a way that is
Okay.
not quite American culture. So I do think it was Josh who truly was like, I will not allow you to railroad my wife in any scenario. But as far as her involvement, it felt incredible. Like, when like I said, I had most of my pregnancy in the UK, and I have come after living there for, or, having our house there and my husband, I have come to think of it as home in a very
Okay.
big way. And I remember she left, and I said to Josh, I said, it's just like we're right back at home. Like, she is actively looking out for her patient as an individual,
Right.
and it was total relief. I remember I was so, like, happy to feel like there was somebody else who was in my corner, and better yet, like, somebody who didn't have to be in my corner, like my mother or my mother-in-law or my husband. Like, this impartial person came in and came out swinging for what it is that I had wanted, and it was like a breath of fresh air. It was so great.
I love that. I love that. And shout out to Josh for, you know, doing what he could to make sure you got what you needed. I think having husbands that are, or having partners, I should say, that are supportive in that way and don't back down and are willing to fight the fight with you, I think is super important. So good job on his part. Better job on your part, making sure that you said what you wanted and you stuck to it and you didn't let them tell you otherwise. Do you think that that could potentially, in some situations, prove to be dangerous if a person that would be considered the patient is telling the doctors that they want something very specific that the doctors are actively telling you you should not have?
Ooh, that's a very complex question, that is. I This is an interesting one. I think that a patient's voice is one of the most important parts of the equation. And I think that that voice has been essentially eliminated from the diagnostic culture of medicine here.
Okay.
But I also think that you have to respect it. Like, your doctor has to be able to talk you through their thought process and why it is they think what they think, and you have to be ready to sort of listen to what they have to say and give them a chance to really logic it out for you, because
Right.
you should be able to understand when a doctor says, I cannot do what you're asking, and here's why.
Hmm.
That's an important thing, but I think that patients need to be more involved in their own treatment. And I'll even extend that statement a little bit further, which is that when you have a child, parents need to be more involved in their children's medical decisions and not
Hmm.
automatically defer to the doctors of your child?
I don't know how many people are confident enough to do that, right? Like, I think we are just programmed to believe anything that doctors say, and we're not trying to say that doctors aren't educated or do not have the correct information. But when you feel something in your spirit and in your gut that's telling you to go left when everyone's telling you to go right, I think that not everyone has the strength, if you will, to combat something that a doctor is telling them. So
I completely agree.
what would you suggest to mothers or even fathers out there whose doctors are almost like intimidating them in a way, right? Because and it may not be conscious intimidation, but it can be just based off of degrees and information and years spent on the job. Do you have any advice on how they can find that level of strength to combat something that they don't agree with?
I think that the first step is to understand that if a doctor wants to have a course of treatment for you or your child, excuse me, if they want to have a course for you or your child, that the doctor should always be able to explain it in a way that makes sense to you.
Mm,
If it doesn't make sense, ask questions. Help them to explain it to you better. And if even if you're asking questions and you still don't understand, don't go with it.
okay.
Because the doctor's job is essentially to come in and say, hey, here's what I think the problem is. Here's what I think a solution is.
Mm,
And they should be able to explain that entire course to you. And it's their job to come up with it. But they are not, like, you are not so stupid that you can't follow their logic through the
right,
process. You just couldn't have come up with the answer yourself.
right.
That's where their training comes from.
Mm,
And so you should be able to understand exactly what the problems are, the solutions are, and you should be able to walk yourself logically through it. And if you disagree with the logic, to ask the questions that challenge the areas that you think. And if you still think that they are not sort of giving it an approach that you think is reasonable, that it is always okay to seek another opinion.
there you go.
You can always ask somebody else. And I might note that this is an incredibly challenging thing to do. I grew up in a house where my father was a doctor and he questioned everything. He came to all my doctor's appointments and always questioned what they thought the problem was, why they thought the solution was the right solution, and how they stepped through it. And so what I learned is that even doctors can question other doctors,
Right.
and that is a valid and appropriate thing to be doing, and that as parents and representatives for ourselves, that we
Mm,
have the obligation to do the same thing.
I love that. I love it and agree. And I think that's solid advice for any parent out there that may be struggling with that or, felt that same instinct but just didn't know what the next step should be. So I think that's great.